Tax Network Organization, and the guidelines and principles on human rights and fiscal and tax policies and Latindad. This week started on Monday and will be done on Friday, obviously, and it's full with interesting conversations on how we focus tax policies and human rights and how we're able to move forward this regional agenda that has many years existing. Now, the event that has brought us today is related to socioeconomic policies that have been created in Latin America and the Caribbean, and that governments have used in order to face the pandemic crisis. You know that this crisis, it goes way deep and has been taking many lives, but not only lives, also employment and resources, and it forces us to look for other type of resources where there just aren't any or where we haven't looked for before. So tax justice, we believe, is one of the options, one of the roads to achieve improvements in each of the country's incomes so we can face the pandemic, and not only the pandemic, but also the austerity in the different levels that have been applied throughout the region. Unfortunately, in our region, we are still being affected by the pandemic. In Colombia, there have been protests out on the street with the militants killed by the army and the police. And this, of course, reminds us that the pandemic hasn't really eliminated injustice, hasn't eliminated the will for justice, I mean. So this framework puts us in the position of discussing these socioeconomic policies with a different focus in mind, because we have elections in Chile where the right has been defeated. We've had elections in Ecuador where there's been a twist, and everything that has happened in Colombia that I just mentioned. All of this is going to be discussed during this event on COVID-19 and tax policy and human rights in Latin America and the Caribbean. So now I would like to introduce the panel members that have been involved in this report that assess social and economic policies that the government have addressed in different levels. Graciela David, economist and advisor of the network, has considered the SOTCON and the Equatorian network. And she has also included the Andean region. And Jorge Coronado, part of the Latin American and the Caribbean network, has addressed South America. So I would like to introduce Graciela. You are going to have 10 minutes each, and then we are going to have a Q&A session. Graciela, please. Thank you very much, Adrian. And I would like to congratulate you for this initiative in human rights within tax policies and the network of Latin America and the Caribbean. Well, I'm sharing with you a presentation. It's in Spanish. However, I'm going to be speaking in Portuguese. So I will speak more fluently. There's interpretation services available. So those of you who want to listen in Spanish or in English, you can select the icon down to the right, and I'm going to continue in Portuguese. So today's topic is pandemic and socioeconomic policies in the South countries as well as in Mexico. This is based on human rights principles. So I would like to start by discussing the context of the economic, what is the context and the socioeconomical context, as well as the health context in the different countries before the pandemic. So here on this table, we can see how they were doing when the pandemic hit. So what context, what fields are suffering the most? Well, first, we have economy. What has happened in the different countries? Well, there was a GDP drop in all of the years, There is a GDP per capita that's a little bit below compared to Europe, and there's an intermediate position in terms of human development. This GDP drop could have important consequences in human rights, and this is actually what happened. Since our countries facing the crisis already had a crisis before the pandemic one. So they already had tax austerity measures in place. So there was an impact in the budget. And this happened in policies that were important, such as public health or social security, cutbacks in policies for incentivization to private companies. So, a fundamental factor to face the pandemic ended up affecting human rights. What catches our attention the most in this data is that many countries did not have information on the number of beds available at hospitals per inhabitant, nor the number of doctors per 10,000 inhabitants. This is not something that happens in developed countries. And this is a very important difference when facing a pandemic. So here we can see data from ECLAC in terms to other countries. And this is an important indicator because in the pandemic, these are indicators that show what are the measures of, for example, isolation facing a pandemic. Another important situation that we should check is the relationship between the guaranteed income coming from tax collection, a tax collection that would be on income compared to a flexible one that could have a true impact on public spending. Now we can see that the countries that have higher direct tax income have a correlation with public spending in health sectors. The doctors, despite receiving increases in income during 2015 to 2017, had a public expenditure reduction in health matters. So in a perspective of human rights, this catches our attention because we don't have any resources available to guarantee rights. And it is important to increase the potential of expenditure in public services. Also, something that's important to stress is health expenses, the public and private one, because as we can see here, there was a case in Brazil that's around 8%. So we could say, well, this is an expense similar like the ones in Europe. The difference is that in Europe, this expense is only for the public sector, and in countries here in Latin America, it is not. Most of them come from private sectors. In the case of Brazil, half of health expense comes from private sector. So public spending in health aspects is quite low as the rest is Latin America compared to Europe. And this has an impact in guaranteeing human rights. Now, what were the measures that countries adopted facing a pandemic? The announced measures. It's important to discuss this because many countries could talk about measurements, but they were not truly applied or they were not applied effectively. However, everyone announced very interesting aspects. For example, in terms of tax policy, everyone announced redirecting measures for health policy, for social protection, for the strengthening of SMEs. And then it dropped. But this caught our attention because it proved that companies are autonomous enough to create counter-cyclic tax policies. And this could set an important precedent for a framework to face other crises in the future and to ensure the guarantee of human rights during a crisis. but not through austerity measures. We always hear that there is crisis here and crisis there, so there has to be cutbacks. So when the pandemic came, we realized that it's possible for countries to adapt during a time of crisis other type of policies and not to reduce in fundamental matters. Now, this will help countries leave crisis faster, and it is also a test on austerity, which proves that these methods are not acceptable from the point of view of human rights because it goes against a series of principles. For example, the principle of the minimum content of human rights guarantee. And if during a crisis rights are cut back, then we are going to have also a crisis that enters in conflict with the treaties and agreements that we have created on social, economic, and cultural rights. And at the same time, there's also another principle, which is a non-social setback, which aims using a part of the budget to guarantee human rights. In terms of financial aspects, it is also very interesting that countries in the region adopted some important measures facing something that's very relevant in the region, which is inflation. So we've always said that facing a scenario of crisis is not easy to accept broad taxes policies. During the pandemic, we discovered, well, not we, but the economists, they found out that inflation can be due to different causes, not only one, and that the increase of public investment even does not generate inflation per se, but this in a pandemic context is an opportunity to rethink the role of economic policy that could guarantee human rights. We're also talking about tax policies and guaranteeing human rights, and maybe we could move forward other economic policies, for example, one based on rights and on monetary policy, as it has been suggested before, which is planned to guarantee rights. And we even observe unemployment rates, for example. There is a very important human right there affected, which is the right to work. And in terms of social policies, there were many measures targeting most vulnerable populations. And the most important thing in our region was that because compared to other countries that we've been checking, the South Cone and including Mexico, informality is important in this country. So a situation where people cannot generate an income besides these social isolation measures where they couldn't leave home and guarantee their daily income, then it is important for measures to be targeting these people. But it is also important to think about people that have lost their jobs that were informal. Then social protection should also be targeted and consider a broad perspective in this scenario. So it is important to remember that human rights and social rights cannot be completely linked to the right to work. This happens a lot in Brazil, in most of the rights which are related to work. But when someone loses their job, then they lose all of their rights. So there should be a minimum social content guaranteed as a term for human dignity, as a minimum essential guarantee. Another very important situation in Latin America that had already been happening is that many countries reduce the public budget that allowed to guarantee rights, as I have mentioned before. And now, when we are still going through a very serious situation during the pandemic, there are already measures being announced again for tax austerity, mainly by financial international institutions. So all of this is being discussed already, which is contradictory because when we consider the documents of these institutions, we see that for high-income countries, they are recommending to continue with counter-cyclical policies. For example, 2 million measures were announced in order to expand employment, infrastructure, to guarantee rights even. to guarantee higher education, for example. But this was not for our countries. These financial institutions are saying the contrary. That's already a moment to start planning, but also to start adopting tax austerity measures. And this is a contradiction to everything that's been said, to the recommendations. So, this is, as I said, a contradiction with everything that we have gone through during the pandemic. So, to conclude, the recommendations are for these regions' leaders, and there has to be a tax collection that's progressive to guarantee a safest tax collection and to guarantee also the funding of social security, healthcare, so that governments consider human rights when decision making related to policies. It is time to launch the 15 principles of human rights in tax policy. And I recommend you to go to our to the webpage of the report and to share it so that governments consider this in their policies. It is also important to talk about international tax collection so that our countries can decide what's the best for us in terms of tax policies. Now, there are several countries that may be involved in this. Now, these recommendations are specifically for discourse and speech coherence. If it is right to have a counter-cyclical policy during crisis times, then it should be for everyone, not only for some countries. So we should incentivize austerity measures during these times of pandemic. Thank you very much. There have been some reactions from the participants. So, as a result of your intervention, when the IMF says that Latin American has to address extraordinary measures, when the IMF says that, well, the first measure to allow countries to overcome the pandemic, then we will need to fill many gaps. Now I would like to pass the floor to Katiuska, and before that, related to what has been happening in Brazil, I would like to recommend a document by Katiuska that's called Who Makes, not Who Makes the Policies, I forgot the name of it. Who Makes the Rules in the World of Financial Institutions, international ones. This is a report that you did for the Coalition of Great Financial Powers. It's quite interesting. Please look for it because it's quite significant and important to read it. So let's see what has been going on in the Andean region. What do you recommend? Thank you, Adriana, and thank you, organizers. I congratulate you for having a week on tax policies and human rights and principles that are inspired in human rights and that support tax policies. It's a very important aspect of economic right, because sometimes economic system is considered as isolated from social aspects.
Que trabajan de alguna manera.
Because it is said that there are individuals that work in a maximizing way, just as we economists consider. But many times we see that social systems include economic elements and they cannot be simplified as it is attempted to do through some mobilizations. Well, this is an introduction. Maybe my part is one of the most polemic one because of some reasons that I'm going to explain later on. I am going to present, as Adran already said, the Andean countries, and Venezuela is not part of the Andean treaty anymore, of the agreement anymore. However, it has been considered in this analysis. We could have considered Chile too, but Graciele already took that country into account. So in this case, we're going to consider the Andean community plus Venezuela. Now, there is a fundamental aspect here. It has to do with the fact that the pandemic evidences a situation of caring for our health or eating. And there are people that unfortunately do not have enough resources to be able to stay at home, keep lockdown measures, and there are elements that have to do with resource redistribution. And many times when we only analyze macroeconomic indicators, we don't see them reflected properly. So I start from certain general situations of these countries, and hopefully you can see this. Yes, okay. So these are the countries that were analyzed. And what we have here is the presentation of the GDP of these countries from 2018 to 2019. And we also have the IDH ratio, and the first country appearing is Colombia, and at the end we have Bolivia. And then we have the GDP per capita with a quite similar ranking since it has a component of the GDP. And in this case, we have Colombia first, then Peru, then Ecuador, then Venezuela, and then Bolivia. So a fundamental matter when talking about tax justice, well, it has to do with taxes, how they are collected. And evidently, as there are more direct tax collection, then more possibility of a current spending, for example, in health. And this is what this graph analyzes, the evolution of tax collection in the different countries and its relationship with the total current spending. So there are some countries that have direct tax collection that are a little bit higher, and Colombia is one of the ones that has the higher incomes in terms of other countries, and that also has a larger current expense in healthcare. So this does not mean that geographically speaking it is well distributed or that everyone can have access to services that are free. However, it catches our attention that despite having this direct tax collection, they still proposed a reform, a polemic tax reform, that caused the mobilizations and demonstrations. So we also have countries that have less tax collection, for example, Bolivia and Venezuela, and this has an explanation. Bolivia and Venezuela, followed by Ecuador. And here, as we will revisit later on, this has to do with the importance that for these countries, the non-renewable resources offer. We also have something important to add here. In Bolivia and in Ecuador, if we compare this income with current expenditure, Ecuador, for example, is a current expenditure in health that's way higher, the highest of all of these countries. However, it is not covered enough with direct tax payments. And the same thing happens with Bolivia, which has in this case a sort of coverage deficit in a health current expenditure. I had already mentioned that there are countries that have this lesser direct tax collection, and this can be explained through the importance that for certain countries, especially Venezuela, Bolivia, and Ecuador, have non-renewable resources as a GDP percentage for them. So as we see in 2016 that we have for every year actually, Venezuela has a share of public income coming from non-renewable resources, which is 10.2. Ecuador has 5.5 and Bolivia has 5.2, but it used to have 9.0. So as the countries can collect in some way, easier collect income from these resources, then they will neglect tax collection, which allows and guarantee more tax space and room. However, I want to emphasize the fact that we have tax room allows to have more active public policies. However, this does not necessarily translates into better social conditions for many reasons that I will explain later on. Well, so I also want to mention how the infrastructure and health foundation was. Now, in this case, Colombia has an index of beds per hospital, beds per inhabitants, which is the highest one, 16.8, followed by Peru, Ecuador, Bolivia, and Venezuela. And as it has already been mentioned, Graciela already mentioned this does not mean that these beds are all public. There are also private ones, and the public ones include Social Security, for example, that they are not truly affordable for the entire population. And then there are situations related to COVID pandemic, which is availability, medication, and doctors availability. So we have Ecuador, first place with 20.37 doctors per 10,000 inhabitants. And to propose a starting point, I would like to mention that during the pandemic, Bolivia and Colombia received resources both from the LACAF, World Bank, and the IATP and the IMF for these two countries. And in this case, what Colombia is receiving is a line that they already had, but it is a very important line in terms of amounts, and that was not used in its entirety, which is $17,600 million. So it's like $5,400 million what they used to have as a flexible credit line provided by the IMF. So the context here would be what I just mentioned. But in terms of concrete policies, it is important to add that in terms of policy, and I'm going to go back a little bit, in terms of monetary policy, we have a quite active participation of the countries. For example, Bolivia injected 3,000 millions of Bolivian pesos through the purchase of bonds that were in the ownership of pension funds. In the case of Bolivia, they ensure that there's enough liquidity. In the case of Colombia, in terms of monetary and tax policies, they reduced the interest rate. They purchased 500 million pesos in private bonds. In the case of Peru, the Central Bank Directorate reduced the reference interest rate and created a savings account for everyone older than 18 years old without a previous account. In Peru, a supplementary credit was approved in the public sector by $29 million to finance activities in the health crisis. So I want to state that Peru and Colombia were able to have different measures due to their policies. So it was very easy for them to promote them. In the case of Venezuela, the requirements of reserves for commercial plans were reprocessed, and in the case of Ecuador, there was no monetary policy. And what was done was eliminate the interest rates generated for late payment. And the defense law on dollarization has just been approved in terms of economic policy that could have serious consequences. Another important aspect has to do with social protection or work deregulation. And all of the countries, let's say, there were different measures, different type of supports, and I'm not going to read all of this because it is quite long. However, countries, for example, Bolivia, fostered a family bond and a bonus, and the coverage of this program was increased. In the case of Colombia, there was an additional income provided to homes that received the aid. An economic incentive was also provided to family members, and the VAT percentage was also redistributed to low-income families, and an additional income called solidarity income was created. So a quite active policy was kept, and one of the hypotheses that I would like to analyze is that this active policy during COVID evidently in most countries lasted for a certain period of time. It didn't last longer. And in countries such as Colombia and Peru, for example, there were those who had more tax room. So they promoted active policies, especially in terms of trying to keep income capacity or expenditure capacity and to keep a certain level and quality of life in this population. But it caught their attention that specifically in this time is what uh, specific is in this time where they start offering this type of aid, which is kind of curious because, yes, for example, Colombia kept a great situation and kept the possibility of having access to this credit line. It kept on, or it still wanted to keep their macroeconomic indicators in outstanding, for example.
Que a pesar de que uno puede
and this caused an omission. Besides having active policies focusing on only prioritizing macroeconomic indicators without taking into account the impact and the amount of and the extent of COVID in unequal countries, make them lose the perspective and make them want to promote a tax reform or amendment in a time that had elements that may have been positive, but it was not the right time. And on the other side, they were quite present in tax collection on people. And this is something that generated, of course, a lot of concern and mobilization. In terms of Ecuador, there were also some transfers during the first months to people that earned less than $400. Also, payments to Social Security were delayed. In the case of Peru, there was a very active policy, especially in terms of SME incentives, and also there were subsidies to companies, and a support fund was created to provide it to SMEs. Now, workers receiving less than $400 a month also received the stipend, and some other measures that, as I say, were quite active. And now I'm gonna revisit that at the end. And in Venezuela, the salary of all of the SME workers was paid for 6 months. There were also other measures in terms of warranting new credits. You only have, okay, thank you. Something important in this field is that as countries had a coverage percentage for seniors that was way larger, made it easy for population to overcome the situation. And here, for example, we see that there's an indicator of seniors covered by Social Security. Now, these index are quite low, both in Peru, which is 21.71, as well as Bolivia, which is 22.29. Very well. So, the one that has the largest coverage is Ecuador. And I don't know how much time I have left. No, you need to close. Yes, please do. So what I would like to conclude is that countries could have certain macroeconomic indicators, and this facilitates keeping these active policies. But it is not just keeping it permanently, but also promoting active policies that, for example, in the case of Peru, it was quite contradictory because these active public policies were considered as an element that was completely out of an analysis. And it was the fact that, for example, homes in Peru and poorest homes in Peru did not have access to food for more than a certain time. So this variable that was like basic made policies unable to keep populations indoors. So despite, policies that were promoted were not really followed because population couldn't really stay at home. And on the other hand, we see that these inequalities can only see surpassed as we have, yes, tax room, but as the society can contribute in terms of tax payment. And something that I'd like to stress, because I really didn't have time to explain the report, Bolivia, for example, between the analyzed countries, is the one that promoted a tax on a large fortune and wealth. So this allows to change this direct tax distribution, reducing dependency to non-renewable efforts, and at the same time reducing inequalities that at the end up affecting coverage both for the right to health as well as other rights, and especially because they allow to have a permanent policy that funds uh, permanent policies and rights. So, as I said, I invite you to read the report and especially to jointly think some of the elements. And here there are also some countries that belong to this idea, so it will be very important to hear what they have to say about this. Well, in terms of the report is just being edited so that you can enjoy it. It is going to be posted on all of the web pages and the platforms and all of the organizations that were part of the initiative. So it's going to be available everywhere so that you can go over it in detail. Now I would like to pass the floor to Jorge Coronado, Costa Rican sociologist, that's going to talk about Central America. Jorge, please. You're on mute.
Estás con el micrófono apagado.
Your mic is off. Yeah.
Perdón.
Sorry.
Okay, buenas tardes.
So, good afternoon, everyone. I'm going to try to adhere to the 10 minutes that I have available. Well, first of all, Central America and Dominican Republic, which is the sub-region that I developed, that I worked on. Well, it's important to say that this is the most impacted area of the continent by the pandemic, and not really in terms of the indicators of the pandemic effect on health matters, but because of the social and economic impact. And let me explain why this happened. So before the pandemic, as a sub-region, we had the worst in social indicators that have been increased also because of the economic situation, as Graciela and Katiuska have mentioned. We can see the impact at an economic level. We can see the cases of Panama, of Honduras, that in 2020, the pandemic recession the pandemic has caused that the economic recession is truly powerful. So what 2021 has brought, the assumptions that we had for improving indicators, economic indicators, are not being met because the pandemic, far from disappearing, it has been current as a new third wave, and this is causing causing a discussion about economic deterioration. So as a sub-region, we already had almost 50% of the Central American population, and Central America has a little bit more than 50 million inhabitants living in poverty. And this poverty in all of the countries, as you can see in this table, in 2020, for example, in December 2020, poverty has increased in all of the countries, even in places such as Costa Rica and Panama that had, let's say, low poverty levels, but now it is growing in 4 or 5 percentage points in only 10 months. So this is why it is so serious. We're just talking about 10 months apart. So unemployment as a result of the economic situation has increased. And we could say that at an economic level, there are two effects. One, the informal market, where we can measure unemployment rates that double in some countries. For example, Costa Rica is one of the most affected ones in the formal employment because of the loss of employment. But the other problem is that Central America has as a work insertion logic informality. We have the cases of Guatemala, Honduras, El Salvador, and Nicaragua, where people having a job, between 70 to 80% of all of the the economically active population is in an informal job. Panama and Costa Rica and Dominican Republic is also here, but we're talking about the 50 and 57%, which is a sector that hasn't received any accompaniment, any informal accompaniment, but also it is the most impacted one because it's the first thing that was concluded in economic situations. You know, small companies were closed down, SMEs, mom and pop stores. So that's why this is the result of how the market was affected, both markets, formal and informal. Now, we could literally say that in Central America and Dominican Republic, there is no system for social protection previous to the pandemic. So if we see the percentage of social investment to data of 2018, then we can see as a GDP percentage that Dominican Republic and Costa Rica are the two countries with best investment indicators, but in the rest, where there are the most impoverished countries, what's invested in public health is truly minimum. If we consider a doctor's average per 100,000 inhabitants, our sub-region is 12, in Latin America is 22.7, almost 23. And if we take it to the hospital, the average in Central America is 8.4 per 100,000 inhabitants, 8 beds, and the average at a region level is 18. So here we can see the differentiation so abysmal. So in average, only 25% of the population is covered by some medical insurance, and only between 15 and 20% of the population have access to a retirement fund. So the cycle of exclusion is one that's structural in Central America and in Dominican Republic. And the pandemic is radicalizing it. We've been 15 months in this pandemic, and this is going to become more and more complex, and this is going to also aggravate the effects. This is why I was telling that the Central American sub-region has had a very strong effect. What is the tax impact? Well, it's quite strong. The last data here to September, well, that's the most recent one, but in the report, it wasn't there yet. So this data shows that there is a general drop of income tax collection as a result of the pandemic. In the case of Honduras, of Panama, those are the most emblematic one. And this is for income tax as well as VAT, which is similar in both cases. And this drop of tax collection causes a problem. We are the sub-region with the lowest tax collection in the continent. In the case of Panama, as you see here, they have the canal in taxes, but in the case of Guatemala, that's not even 11%. The rest is kept in very low levels. And also, if we correlate tax burden with expenditure, I mean tax exemption, exonerations, and tax privileges, then we realize that they imply as a GDP percentage, a quite high one. I see that Honduras or Dominican Republic shows that poverty indicators, and especially in Honduras, they are quite high. So their tax privileges are way higher too. And effectively, with the drop of tax collection and keeping those tax privileges intact, we've seen a very complicated variable. So this is increasing the entire situation of tax deficit and making more complex and limiting the fiscal room to reduce public policies in our countries. So what have been the first or the main measures taken? Well, the health measures, just as in every continent, the close down of borders and businesses and mobility limitation and constraints and curfews were implemented. These measures in 2021 did not have that level of radicality. However, the different measures of health reduction are being still applied in terms of mobility. There was an important part of the measures which were the aid and assistance measures. First, suspending or deferring payment of public services and utilities. This was done in an average of 4 months in most of the countries. And also, in most of the countries, they deferred these payments for utilities to 2 years, more or less, for people in order to help them. Now, in several countries, restrictions to the cut of these products were forbidden. So people couldn't have their water or their power cut off because of lack of payment. There were some temporary bonds between 1 and 3 months that oscillated from $90 to $200 given to workers that had lost their job, formal workers. So the most emblematic case would be El Salvador, that did a bonus of $300, the one-time bonus to more than 300,000 families, mainly belonging to the informal sector. So it appears that right now they are discussing if they should place any new type of temporary bonus. So let's say that these measures focused on the business sector. So tax amnesties were given, exemptions were expanded as a stimulus not to close this sector. Money was given to them so that they could, VAT was suspended. So yes, it's going to be charged, but they don't have to send it to the tax collection offices. They have also enjoyed credit lines and credit banks, and credit provided by banks. This for the SMEs. And in Panama and in Costa Rica, for months, there has been temporary reductions to employer contributions to Social Security. And Katiuska already mentioned some commonalities for the Andean region, which is the work standardization and regulation. So the employer sector has been incentivized to reduce working days and how long they last, and to also apply this as a palliative measure. And this puts the situation, this puts formal employment in a very serious and delicate situation, because there is a risk of this deregulation to be installed permanently. And the other is that there is a very limited tax space. So many countries have been falling into more and more debt because almost all of them agreed to the IMF emergency funds applied in the second quarter of last year. And the Central American Bank of Economic Integration and the IDB have also offered new debt, which also aggravates the public debt situation. Jorge, to conclude, please. Yes, I'm going to conclude, Adrian. Public invested that's been deployed has been important, and it is absolutely insufficient. Today's crisis, from my perspective, has worse consequences than the crisis aggravated by the war during the 80s in social terms. There is no support measurements for this 2021, and the emphasis is protecting business stock. And yes, the public debt matters are aggravated, as well as public policy erosion. And the logic of austerity is reproposed, budget austerity. And our social protection system is going to be completely deteriorated, because the universal income or minimum vital wage will turn into a survival mechanism for our countries. This means that it is a truly complicated overview and horizon that we have before of us that has been aggravated by the pandemic. Thank you very much. Thank you so much, Jorge, Graciele, Katiuska, and we don't have any more time, unfortunately. It's like a TV show, you know. But I still want to mention, first of all, that the proposals that you've had and interventions that you've shared based on government's proposals for crisis include the political context that this is developing on, you know, that has to do with Colombian protests due to the radical change that's been happening in Chile, the elections in Peru that also have an important weight. So many things are going to change from now on, and we have to be attentive to this because we have to keep on demanding from the governments this type of aspect. So this information is going to be available in our web pages so that you can download it. Before concluding, I have been given a task, you know, that has to do with showing the graphic summary by the illustrator and also introduce the new session that has to do with tax transparency organized by Fundar Mexico. So that's all on my part, and thank you so much for your participation, panel members, for participating. And now I would like to pass the floor to the organizers so that they can continue. Thank you.
Muchas gracias a todas y todos y esperamos puedan unirse al siguiente evento que
Thank you, everyone. Hopefully you can join the next event that's going to start in 5 minutes. It's going to be about tax transparency, as Adrián was saying.
Adrián.
Thank
Gracias,
you, Adrián.
Katiuska, Jorge.
Thank you, Katiuska,
Graciela.
Jorge, and Graciela. Thank you.
Gracias, un abrazo.